The Regional Coordinator for the Healthcare Systems Preparedness Program, and thank you for coming again. We seem to be meeting on a regular basis here. Joining me today are our partners in public health, hospitals, and clinics as we prepare for our emergency preparedness, whether it's a natural disaster or in this case coming together for planning and coordination activities surrounding H1N1. Today we're providing an update on our flu prevention and our response efforts with the specific goal of preventing, again, as many people from becoming ill as possible. And again, the simple facts. Number one, first, there is a difference between the seasonal flu and the H1N1. Second, there will be separate vaccines this year, both for the seasonal flu and one planned for the H1N1. And a third point is they will not cover for each other. So the seasonal flu vaccine will not cover for H1N1, nor will H1N1 cover for the seasonal flu vaccine. We have lots of information this morning. We've got 3 presenters that are going to talk, and then we'll open it up for additional questions. On the front lines of our prevention and treatment efforts are our healthcare providers, and we're very fortunate to have the ISJ system and Mankato Clinic represented here today, along with local public health. So at this time, our first speaker is Dr. Brian Whitehead, the medical director of the ISJ system, with some remarks. Dr. Whitehead.
Great, thanks, Eric. Good morning. Today what we want to do is really cover some very simple but key topics for everyone. I think first and foremost is that, quite honestly, the H1N1 is in our community already. We know that it's here. We know that there's several cases that are around. You probably already know people that have come down with symptoms. Our key message is that we really want to get out to our patients and community that there really don't need to be any reason for them to come into the clinic, ED, or hospital if they are ill. There really is some strict guidelines around who we will treat and not treat. We really are not testing anybody anymore. At this point, we assume anybody that has flu-like symptoms has the H1N1 because the seasonal flu at this point is almost non-existent. So we know that that's what's happening. So our message for the community and patients is that please do not come in if you're a healthy adult or child with flu-like symptoms. Now, there are instances when we do want to see those patients if they indeed have a high fever, they have respiratory distress, they do have chronic disease underlying, they're diabetic, they have emphysema or asthma. Those are the kind of patients we do want to see into the clinic or the ED if necessary. But the point is that we want only those patients and not those that are really walking well, if you'll use that as an analogy. Those seems to be the symptoms are mild, they're recovering from it fine. The same goes for testing. We are not testing for H1N1. We assume that that's what it is. And we are also not treating those same groups of patients. We are only treating those that meet the CDC guidelines. And again, those are children under 5 or older than 65, pregnant women, anybody that has chronic disease underlying, they would be candidates for treatment with antivirals. And then finally, anybody that's a caregiver of a child of 6 months or younger would also qualify. And that's for the reason that the vaccine is not available for 6 months or younger when it becomes available. So those are some of the key messages. We have, as I said, trying to keep it simple and trying to drive home the key points. And so I'll have Dr. Mathias join with some other points.
Okay. Well, I'm going to emphasize a lot of the same points here. As Brian said, I'm Mark Mathias, the Chief Medical Officer at the Mankato Clinic. And we've been noticing, as the whole community has it, we're starting to see more and more of the cases of influenza-like illnesses hitting both urgent care, our primary care departments, as well as the emergency department. Fortunately, it has remained relatively mild. And so our message that we're trying to get out to people is please don't come into the clinic if you have these symptoms, because we will not be testing you, we will not be treating you unless there's certain categories, and we want to make sure that that gets out to all of our population. The vast majority of our patients who are healthy otherwise are going to go home, they're going to get better, they're going to feel miserable for several days. We want them to go home, drink lots of fluid, and most importantly, stay away from other people. And it becomes important for us and our own employees of having them stay home, and there's a little different rules for healthcare providers. But there's not much that we're going to be able to do, and people get very frustrated, and people are demanding that we test them for it. And we're really sticking hard to the Minnesota Department of Health and the CDC guidelines, and unless we're hospitalizing you, we will not be testing you for the flu shot, for the flu, I'm sorry. The problem is there is no good test for H1N1 flu. We have a test for type A flu, but it's only 50% sensitive. So if it's negative, it does not necessarily mean you don't have it, nor if it's positive, I'm not going to treat you anyways unless you meet certain criteria. So we're really going by the symptoms. We're asking that employers and we're asking that daycares don't send either their daycare attendees or their employees into the clinic to be tested, because we're not going to be testing. And so I think there's a little misconception about that. On the other side, when a person is sick, please do not ask that your employees come to the doctor to get a note saying they've been sick for 3 or 4 days. Both ISJ system and the Mankato Clinic has changed their own HR policies where we're no longer requiring for this illness a note from the doctor saying you've been out for 3 or 4 days. That's just going to clog up our system. And again, we don't want all those people who have the flu showing up in our clinic, further spreading the possibility of the flu. As Dr. White had said, there are certain people that will be giving antivirals medications where we have some protocols in place, but unless, again, that list, under 5 years of age or over 65 years of age, have underlying diseases such as obesity, asthma, heart disease, diabetes, or if you're a pregnant woman, we're not going to be giving you the treatment. And so, again, there's no reason to come into the clinic for hopes that you're going to give something or get some sort of treatment. So to summarize again our message, most of our patients are healthy. We want them to stay home. We want them to avoid giving it to other people. We're talking about staying home for at least 24 hours after your symptoms have resolved. We're asking employers, not to ask that your employees come in to either be tested because we don't have a reliable test, or to be treated, or to get a note saying that they've been sick for this amount of time. We've changed some of our policies. We're asking everybody to look at some of their HR policies as well. The main message is stay home, avoid other people getting sick, and I think we're going to talk about some of the ways to keep yourself healthy, and for that we'll turn it over to our public health colleagues.
Thank you. Like Mark said, we'll talk a little bit about prevention and some other information that we'd like you to hear. I'm Kelly Hayter, Supervisor of Blue Earth County Public Health. This is uncharted territory for all of us in healthcare. The situation with these 2 separate strains of influenza is fluid. As we've seen over the last few weeks, changes occur frequently. One thing that has not changed, however, is our messages about emphasizing prevention. That includes covering your cough, and I know I've been up here saying that before. Cover your cough, wash your hands, stay home if you're sick, keep your children home if they're sick. It also includes getting vaccinated against both the seasonal flu and the H1N1 flu. The H1 vaccine, as already mentioned, is expected to be available in limited amounts beginning sometime next month. Several of the manufacturers of the seasonal flu vaccine also manufacture the H1N1 vaccine now that it has been approved. Due to the intense interest on behalf of the news media and the general public, however, manufacturers have shifted their resources away from production of the seasonal flu vaccine towards production of the H1N1 vaccine. Healthcare providers in our area and around the country have been informed by manufacturers that there's a delay in shipments of seasonal vaccine because of the emphasis on the production of the H1N1 vaccine. That does not mean there will be a shortage of the seasonal flu vaccine. It only means that there will be a delay receiving the seasonal flu vaccine. That delay may vary from 1 to 4 weeks depending on the manufacturer. Many healthcare organizations in our area have received at least some of their seasonal flu vaccine and have implemented plans to ensure as many people receive the vaccine as possible. We're confident that all the shipments will eventually take place, but we're asking the public to be patient while we and others around the country are dealing with this situation. Healthcare organizations in our area, 2 of the largest which are here today, have already scheduled flu clinics over the next several weeks. They're evaluating their current supply of the seasonal vaccine and will be announcing plans for clinics on a week-to-week basis. Once again, I want to emphasize that even with the delay in the availability of seasonal flu vaccine, there are steps we can all take to prevent spreading this illness. Cover your cough, wash your hands thoroughly with warm water, use alcohol-based hand cleaners, stay at home if you're sick, keep your children home if they are sick. On a final note, we are very fortunate to have our major healthcare entities and organizations working together in our region in a true model of collaboration.